So welcome everyone to our September Arctic session titled How to Create an Overarching Research Agenda. We have a couple of excellent speakers lined up today. Our first speaker is Dr. Theresa Liu. Dr. Liu obtained her PhD from the University of Tennessee and is currently a KO1 scholar and assistant scientist in the Ricky Lab at the University of Wisconsin-Madison. Her research focuses on the role of estrogen receptors on benign prostate hyperplasia development and progression. She is specifically interested in the protective effects of estrogen receptor beta. We're excited to have her here with us today, and thank you. I'll go ahead and turn it over to Dr. Liu.
This is a huge topic, and I'm just going to kind of give you how I came about my research, and hopefully that will help you come up with your overarching research agenda. So, where I am now, so I am interested in estrogens, but it's kind of changed now into looking at overall aging mediated changes and how that contributes to initiation, progression, treatment resistance of BPH-LETs. So this is kind of my current research agenda, but how I got here isn't necessarily a straight path. It wasn't, I started working on this in grad school and came about this. How I got here is actually quite different. So in grad school, I was studying transcriptional regulation of antifungal drug resistance. So it was completely on the mycology side of things and not looking at humans and the human response at all. So it was a yeast lab, and I was studying disease processes in that way. And at the time, I didn't want to do human translational research at all in grad school. I thought I really wanted to do infectious diseases, and that was kind of where I saw my career and my research path going. But when I graduated, as a part of my grad school, I was doing a lot of um, genomic studies, and I really wanted to learn more computational biology. I really wanted to be better at that. So when I went on to do my postdoc, I joined a computational biology lab, and they were looking at prostate cancer and looking at non-coding RNAs and that. So it was completely different than what I had studied in grad school. But in doing that, not only did that bring me into kind of the prostate field in general, but I was working on prostate cancer as well as a benign project there as well. And so it was working on that benign project at the University of Pittsburgh that brought me to UW and the K-12 program. And so I was working there looking at estrogen receptor beta and how that plays a protective role. And then when I got to UW, I expanded on that and really started to look at how that is protective, looking at mechanisms of action of estrogen receptors in the prostate. But then as I was doing more and more of this and studying BPH, it was kind of um, fortuitous that it's a disease of aging. I was thinking about aging a lot, and there was an aging meeting that was coming up. And so, kind of on a whim, I decided to attend, and it was a phenomenal meeting. And when I got back from that meeting, it really solidified how the disease BPH that I was studying could be looked at from an aging perspective and not just from a urology perspective. And so a lot of the studies that I wanted to do, the aging field has already done in terms of other diseases, but nobody had actually looked at it in terms of urology. And so that really brought me to where I am now looking at aging and my KO1, because now I can look at not just the disease process and how we treat BPH clinically, but how normal aging is contributing to all of these changes that is happening. So the research that I am doing now, I would never have thought that I would be doing this as a grad student. I think the grad student me would have wanted nothing to do with aging, with prostate, with the human side of research. But I find it now hugely interesting. And it's not that all of the things that I did before haven't played a role. I think all of the um, different research topics that I've done has given me tools and insight into what I'm doing now. And it really has helped in terms of figuring out the questions that I want to pursue. And it gives me a different way of thinking about things in terms of my research. So I think really what I've learned from this is you have to be somewhat flexible. You can't just say, okay, this is what I want to do, and not be open to um, the changes that you come across, or other people's ideas, because it really does help as you talk to people and try to figure out where you fit in, where your research fits in. So how did I actually come to kind of my research question, and how do you make it better? It really helps if you have really good mentors and collaborators. I feel like they have been extremely helpful in helping me decide which projects to pursue, what ideas to go after, because I don't have that experience in terms of that, right? Everybody else will have different perspectives, and my mentors and collaborators have more experience in total than I would ever be able to have by myself. So that's been hugely helpful. Peer discussions have also been great. So for me, I feel like I need to be able to talk out my ideas. I need to be able to process that with people, and I need input from others. And so at every institution that I've been at, I've sought out people who are kind of in my career stage, sometimes further along than me. And it doesn't have to be anything formal. We've just sometimes gone out and had dinner or gone to happy hour, and we'll sit down and we'll talk about, grant ideas or the research that we're doing, or, things that may or may not be working, whether we're troubleshooting something. And that has helped. And particularly the people not in the field. So a lot of my really good friends that are in science, they do things that are completely different from me. They're in neurobiology, they're in psychology, psychiatry, a lot of different fields. And they have the ability to say, I don't really understand where you're coming from. I don't think that question is what you think it is. And it helps me process that and come up with a better um, way of saying things, or maybe hone in on what I'm trying to actually convey. Like I said, what brought me into a lot of the aging studies was a conference that I thought was interesting, um, that I didn't realize that I would get as much out of as I did. And so conferences and seminars are something that really helps. I know everybody is overscheduled, and if you say yes to a conference or seminar, you're saying no to something else. But sometimes, even if it feels like it has nothing to do with your actual current research topic, sometimes going to a seminar and hearing new techniques or listening to somebody else's approach to a question can help you figure out something that you want to incorporate. So it gives insight and perspective, even if it is not necessarily directly relevant. And then, of course, lots of reading, because I have changed fields now several times, and reading literature and reviews and all of that really does help to see what is out there, what people are doing. And particularly with the aging, I am reading papers in other disease processes to look at what they're doing and how that is relevant and applies to what I'm doing. And then goals and priorities. I like to write these down, but I don't always have like definitive dates. So right now, my short-term goals, I have a couple manuscripts I want to get out and publish. I'm trying to finalize some preliminary data. The medium-term goal is submitting an R1 in February. And really the long-term goal is to establish an independently funded research lab. And throughout kind of my journey, sometimes I have to put very specific, I am going to finish this short-term goal in like 2 weeks, or I have to have this done at a particular time. Where I am currently, I have these goals up. The R1 is kind of the one that has a definitive time point, and I'm just trying to complete the short-term goals to support the R01 submission in February. So I don't really have due dates right now, and this is what's currently working for me. But goals and priorities are important because right now the R1 is what I'm working on, and there's a lot of things outside of this that are obligations that I have. I teach, I mentor students, and there's other career development activities that I'm involved in, and anything that I'm doing there takes away time that I could be working on this. So it's sometimes hard to prioritize, but having kind of the goals written out, whether you need a definitive like due date or something just written out so you know that you're working towards something is helpful, because then you can decide what is most important, and is the next commitment that I'm making, is that actually going to help me towards any of these goals or not?
Our next speaker today is Dr. Dolores Lamb. For most of you here, Dr. Lamb needs no introduction. Dr. Lamb is currently at Weill Cornell Medicine, where she serves as Vice Chair for the Department of Surgery Research, Associate Dean for Faculty Affairs, Director for the Center of Reproductive Genomics, Professor of Molecular Biology and Urology, and Robert S. Dow Professor of Urology. She continues to be a prolific researcher in areas including the genetics of male infertility, genitourinary birth defects, and steroid-regulated growth of male reproductive tumors. Dr. Lamb's research has won several prestigious accolades, such as the Distinguished Andrologist Award from American Society of Andrology, and has been recognized for her lifetime contributions to the field of urology by the American Urological Association. Equally impressive is her mentoring track record, which continues to be recognized by national awards from organizations such as the Endocrine Society, Society of Women in Urology, the American Urological Association, and the American Society for Reproductive Medicine. As a testament to her mentoring commitment, it's worth pointing out that 9 of her former trainees are now department chairs. But we're honored to have you here with us today, and welcome, Dr. Lamb.
Thank you so much, Michael. So I'm delighted to talk to you today. A great deal of my career has been spent on trying to understand male infertility and why this happens, and the causes as well as the treatments. And I always kind of like this article that was about me. It's from years ago, but they put sperm, they pasted in sperm like all around me. And every time I see it, I think it's like visions of sugar plums, on Christmas Eve or something. But I thought it was great when they did that. I really enjoyed that. So I actually grew up in a very small town on the North Shore of Long Island. So where my house was about a mile from that town that I showed you, and about a mile from Cold Spring Harbor Labs, which, as you know, is very famous. This is a more modern picture, obviously. And my house actually, I don't know if you can see the pointer, but it was like up here, because there's a big hill right here that comes down alongside the Cold Spring Harbor Labs. Here we're looking directly at it across Cold Spring Harbor. So I thought I would tell you a novel fact about me. The novel fact about me is that I'm actually a twin. And so I have an identical twin sister. My twin actually played a very important role, in a sense, in my career development, because she has a chronic illness. And so we weren't able to go and live away in a dorm and stay together. So I stayed with my twin and helped her when she wasn't feeling well, through college. And then I even started graduate school locally, because I didn't want to leave my twin. And so, that actually impacted my career development. And, it was interesting when Teresa was saying about not ever wanting to work on human research. And yet I've spent most of my career actually working on humans. It's a much harder path in terms of scientific research, because obviously we can do experiments, in petri dishes and with mouse models and so on. But we can't do that with humans, right? We can't be doing all these manipulations and changing their genes or what have you. And yet, I think that we can do really great research on humans and be very impactful. I was a postdoc at Baylor College of Medicine only for 18 months. And when I was there for about 6 months, I asked my chairman, Bert O'Malley, if I could get a big girl grant, would he promote me? And he said, sure, and I got my grant. So I was only a postdoc for 18 months. And then I was, early career faculty, like many of you are here today. I had the opportunity to go over and have my primary appointment be in urology. And I wanted to do that for several reasons. I wanted to continue what I had done for my graduate school training on looking at sort of the controls of spermatogenesis and male infertility. And I wanted to work on humans, and I wanted to help patients. When I said that I was going to move over into urology, I was told by some of my quote mentors that I was committing professional suicide. I would never get another job. I would never get another NIH grant, and like I could kiss my career away. And so I rose through the ranks at Baylor to be a department chairman of reproductive medicine. And it was so satisfying to me because for the last 10 years that I was at Baylor, I was number 13 or 14 in the entire institution in NIH funding, despite being told that I would never get another grant. And, it just gives me such pleasure to say that, don't listen to some of these things. There's good advice and advice that's perhaps not the best. And you always have to take some of that, and weigh it for your own individual career. So I thought I would show you, I was thinking in terms of how to have an overarching research program and how would we define this. And I want to say that I'm not sure I'm the model citizen to give this talk because I've been NIH funded since I was a pre-doctoral trainee. And I've always had NIH support and federal dollars throughout my entire career. And I want to just show you, these are grants that I've had just to show you all of the different areas that I worked in. So I used to work on maternal responses to the fetal allograft, why the mother doesn't reject the fetus as a foreign organ or transplant. Certainly there's a strong theme here of steroid receptors, looking first at androgen action in the Sertoli cell. Then I used to work on early pregnancy and progesterone receptor structure and function, progesterone receptors in breast cancer. And then returning back to kind of my spermatogenesis era, looking at that, we were one of the 3 labs in the country who were funded for cloning the androgen receptor, except that I will say we were scooped by the other 2 groups that got the other 2 grants. And we were simply not using a fast enough method to try to beat them, to clone that receptor for the first time. But again, you can see various types of things, but I also had, these were all steroid receptor focused, but, I had a grant for electroejaculation of spinal cord injured men. I was improving the quality of life for people with disabilities. And even though I had 2 NIH grants at the time, I wrote that together with my colleague, Larry Lipschultz, because I thought I didn't have enough funding. And I had no clue what other people had. It was a very clinical grant. I wrote the whole thing. It was a great learning experience. And I did it because I wanted to make sure I had plenty of funds to pay everyone who worked for me. And again, you can see then a higher focus on, again, continued focus on prostate cancer, as well as male infertility. And I'd also point out here, for I forget, 11 or 14 years, I had a PO1 that I directed, the molecular basis of male infertility. This was very human focused. And we were really looking at the genetics of male infertility, among the first to ever even be considering that male infertility could have a genetic basis. And again, then I started looking at some of the genitourinary birth defects. And then we go on because here, as Michael mentioned, I had a number of simultaneous career development grants in urologic research and urologic research career development. So the T32 and the KURA K12, which I had to give up actually all of these when I moved from Baylor. And then I also had, at the time that I moved, another K-12, which was out of NIDDK for men's reproductive health research. So this was for training the andrologists, the urologists who do male reproductive medicine and surgeries. But, I applied often, again, for a variety of different things. Congenital genitourinary birth anomalies, I did kind of as a lark when I put that in, because at that time, array comparative genomic hybridization was being invented at Baylor College of Medicine. And I gave the medical genetics lab, so that's an array-based technology to look at microdeletions, microduplications of the chromosomes as a cause of disease. And I had given them my Y chromosome microdeleted patient samples that we were analyzing clinically, diagnostically in my diagnostic labs as a positive control. So they could show that they could actually identify a microdeletion. And we used to do it by multiplex PCR rather than an array-based approach. You can see now I have a lot of funding. Also, so this is currently funded. I've funding from all three of these grants, which are all different approaches to developing non-hormonal male contraceptives. All of them are part of different centers, again, funded in this case by NICHD. And then we did also fun things, right? When Viagra was first invented and commercialized, we decided, I decided to write a grant on sexual motivation, thinking that if Pfizer could get so rich by inventing Viagra, that, we had a lot of patients who didn't have an organic reason for their erectile dysfunction, but had a lack of sexual motivation or desire. So we thought if we could invent that magic pill, that we would do that. And again, we were NIH funded for this. And it was a very interesting, fun project. And then these are some that I currently have in the pipeline, either under review or this one, I'm still trying to work out the specifics of doing a clinical trial on a small peptide mimetic that was actually developed by Merck that I am convinced can ameliorate COVID symptoms and prevent any of the really severe symptoms that occur. And again, that's not urologic, but it was something that I came up with to work on. So essentially, we've done whatever I think is going to be fun, right? Rather than perhaps having a totally overarching theme, although you can see common themes of male infertility and spermatogenesis or male reproductive health, right? Prostate cancer was very long-term in terms of the research that I was doing. And then, of course, more recently, some of these things, such as the non-hormonal male contraceptives, although intellectually that doesn't get me out of bed in the morning, but, I think it's important work that has to be done. And the science has been the most amazing for the congenital genitourinary birth defects. And so we've really had a blast doing that. And as Teresa told you, really, I stood on the shoulders of my giant mentors. And so I just want to encourage you in 5 minutes here to, be very serious about, picking mentors and taking advantage of them. And I have my mentors listed for you here, and we're not going to have time to go through them all. But, I had someone who was a Renaissance man, expert in everything that he did, thinking wildly, creatively, wonderful role model. I also had a role model, of course, my PhD mentor, who was at that time, I was her first PhD student, a young mother, and managing a lot of different things on the home front as well as at work. But many of the people were politically important people, influential people who had connections and people who could champion me. And you really need to have some of those people in your arsenal, if you will, of mentors. And certainly we all need clinical and scientific mentors, as well as a confidant, someone we can trust, confide in, and get, career device. And I will tell you that one of my mentors was really not a good mentor. And he was never really around. And one of my old office mates said to me, maybe John Doe, because I'm not going to mention him, was a better mentor than we knew, because we all did pretty well, even though it was a sink or swim mentality that, there were no life preservers ever handed out, and no accolades either. So, there's all different kinds of mentors, and maybe they're better for us sometimes than we realize. I'm not going to go through this, but there's lots of information on the web, and I think you've heard a lot in this program about the traits of a good mentor. But honestly, you need to have someone who's consistent in their principles, honest, communicates and tells you the truth, as well as being accessible and very savvy to how to help you with your career development. So please be sure to get mentors and understand that the mentor benefits as well. And, really, I always think of the mentorship journey for the mentee, right, as, going up the path of a mountain like this. And so, we can view the mentor themselves as the trusted guide, such as those in Nepal or whatever, going to the peak of the mountains, who can guide your journey and really help you. And I think that it's, again, very important to do this. Now, in terms of selecting your research program focus, you really need to look inward first and think very carefully about what it is that you want, right? So you have to think in the broad term in terms of what is your own personal goal, your life plan, because some of that is going to impact how you can do all the other things that you need to do to be successful. And then you certainly have to identify the area of research focus. And when you do that, you really need to use a whole different collection of research tools, right? And, we don't all always just do the same approach when doing our experiments, that all will build towards addressing what your research goal is. Usually this long-term goal is at least 5 years, sometimes a lifetime, as you'll see. It's always unique to the individual, and it has to be flexible. So think of your research agenda as being a tool that you're going to use that should be revised along the way, updated, and you get new findings. It may give you shifts in your program directions, but you still have that overarching theme to the work. I tried to look at a good example of how you would sort of do this, and I'm going to actually show you one that's directly related to what we all do. But essentially, over time, you have a series of different things that you have to do. They call it capacity, but essentially, you need to figure out what your question is, design your experiments, right? And keep reevaluating, say, how you've succeeded or not succeeded when you test your hypothesis, and you keep morphing the system, because you're continuously doing like a quality assurance, quality maintenance sort of plan, right? Where you keep adjusting, right, as your research directs you towards that common research goal. And so you really have to have a clear goal of what that research should be. And again, as I just showed you, there are going to be supporting steps that help you to traverse up that mountain or to, achieve your goal for the research. And you continuously build and show how you build that agenda over time based upon the effectiveness of the research program that you've designed. So again, you always want to have this be a dynamic thing that guides you through your studies. So if we look at that same sort of concept that I showed you in the generic version of a research agenda, you always want to gather the evidence that supports your premise, right, for the study that you're going to propose to do, that you're thinking about doing. And Teresa told you about how she's spending a lot of time looking at the literature and so on to really decide what she wants to work on. And so certainly your premise then is going to be based on your study of the literature, as well as perhaps your preliminary studies. That then in turn allows you to identify a strong study design. So then you're going to perform your studies, right? And then you try and define your results, right? You are going to ask, was your hypothesis supported? Were you right? Did the data give you a different message that you need to change your direction? And it's only through this sort of insightful consideration of how your experiments are going, are you going to then move to the next step where you can really measure your research performance and assess the research outcomes. And then certainly, you want to then be able to obtain evidence that's substantial. That's going to be your publications, right? And your achievements of your aims that are impacting your overall evaluation of your research agenda. And then, ultimately, you're going to have hopefully evidence of positive research outcomes, and all of which are measuring the research performance. So you really need to spend a lot of time choosing the important area of study. And just to go back, I can't tell you I always did that, because again, if I read something, I always read very broadly in the literature and read a lot. And so I always did something I thought we were going to have fun with and was going to be impactful and that we would get really meaningful results. But, again, this isn't one of your probably the most important step. And when you have that research program, you have to focus on really a specific problem, because you need to be able to show that it's interesting, it's feasible to do, and that you've developed a foundation for your research plan that's going to be successful. And so you cannot be vague with generalities. And the quote I have here, I thought was priceless. Vague generalities are the sign of a vague mind. Very true. And so you really want to be able to demonstrate your potential as an investigator and show your independence from your previous training laboratory. So how do you do this? The first thing you need to do is to really ask a grand challenge question in your field. That is, I think, numero uno. And you have to be able to believe in the importance of your grand challenge question. And you need to be able to persuade others that this work is going to be important. We do this when we write our grants. If you don't totally believe that the project is going to be, life-changing, change your research focus. And if you don't know why it's important, then you need to do your homework. That's a different problem, but it's still a significant problem. And you need to be able to communicate and convey the importance of it. So you always want to think in terms of your research and your research question as the need to elicit a paradigm change. And that should be a big part of your research program goal. So, right, a paradigm is a model or an employer. And when you have a paradigm change or paradigm shift, you change the traditional view to a new way of thinking. And so this gives you very impactful research focus. And it's really kind of a scientific revolution in a field, right? Based on, say, a paradigm changing result that allows us to take the current concept that we have of our field, reject the old assumptions, replace them with new assumptions. And this is how science actually proceeds. And if we look at this, again, just sort of schematically, you have the grand challenge question. There are many different dominating research agendas that you could use to probably answer those questions. The choice is yours. But you need to appreciate how valuable the data is that you generate. And as you know, NIH certainly feels that way. There are new guidelines and requirements actually for protecting our data, because that is the product of scientific enterprise today, which is now far more valued than it used to be, I think, in the past. And, much of this information can end up in what I'm calling libraries, right, which are these huge databases, websites such as Decipher, the database of genomic variants. There's gazillions of these, but these are invaluable to us doing our research. Now, the very important thing is to be innovative in terms of your science and thinking incredibly creatively. And you really have to then use your imagination, give some careful thought to create something of value, right, for science and medicine. And again, it is through innovation that we create these new paradigms. So these paradigms, significance, creativity, innovation, are the things that are hugely impactful in terms of our research, in terms of our impact in the field of, and also for getting money. And, thinking out of the box is important. And, I always think about Einstein as being such an incredibly smart man and, kind of the epitome of significance, creativity, and innovation. And I just thought I would show you an interesting quote from Einstein, and it's easy reading here. But this was something that was discovered by Einstein's son in his paperwork, which was a note to his first wife, he was giving her orders essentially to be a maid. Right. And like that he wasn't going to be company for her. He wasn't going to go out or travel with her. He had a whole series of rules for their relationships and how she should behave. And it's shocking to discover, this was wife number one, that, and her last name was Einstein-Marek, that in the papers that were found, she also was a physicist and very superb at what she did. And it's been argued that she was a lot of the brains behind some of Einstein's discoveries, right? And she did not get any, credit for the work that she had done and the substantial contributions to his early work. So even though he was a clever guy with lots of innovation and creativity, he was lacking in some of these other skills on the home side, which I thought was just amazing and real learning experiences. Very interesting things that you can read about this on the web, and there's books on this as well. So, how do you do all these things as an early career investigator, in terms of setting your research plan and your research agenda? Because, the ultimate thing is that you have to show that your ideas are fresh and new, right? And also that you've experienced, it's feasible that you can do the work that you're proposing to do. And so it's been said that it's usually best to build on your prior experience when you're looking forward at your research plan, but it should not be a direct extension of the postdoctoral work, because again, you want to do something that's going to set you aside and distinguish you from your postdoctoral mentor who, was probably quite prominent in the field. So you want to be seen as an independent investigator.